Welcome back. These ice raids have communities across Southern California on edge right now. The mental toll of ICE and the National Guard being here could affect how people feel at work, at home, or just in general in their everyday life. So joining us live to discuss how to deal with the anxiety and stress being caused by the ongoing raids is Dr. Ricardo Whyte, the Chief of Psychiatric Services with Dignity Health Community Hospital of San Bernardino. Dr. Whyte, good morning. Thanks for joining us.
Good morning, Irene.
So even just watching the videos, it can be incredibly overwhelming. And what kind of mental strain or toll can situations like this place on people, especially those who are concerned about possibly being detained by ICE?
Irene, back in 1967, Dr. Thomas Holmes and Richard Rahe developed a stress scale. And one of the things that they determined was that the concern about stress can actually be connected to physical illness. So one of the things they ranked, for example, things like death of a spouse, divorce, marital separation, imprisonment, death of a close family member, personal injury, even marriage. And what they said was if you score over 300 points, you are at high risk for illness, 150 to 299 moderate risk, and under 150 low risk. So there is concrete data that these kind of stressors can have quite a profound impact on a person's well-being.
How about specifically for kids? I know there are a lot of kids who might be watching the footage and have fears about what could happen to them or their family. How can parents help them deal with anxiety or stress over this?
What parents really want to do is to be on the cutting edge of their child's understanding. And in order to do that, they really have to take a listen to see what is that child capable of understanding? What are their fears? So they got to start with listening. And then, informed by that, they can then speak in a way that is helpful to that child.
And for people who are out there protesting, what can they focus on mentally to keep their calm when situations might become more escalated or more intense?
Well, there's some interesting statistics you may want to be aware of. So, for example, LA is about 39% Latino. The National Guard is 22% Latino. The California Highway Patrol is 36% Latino. And the LAPD is 56% Latino. So it is very likely that in the course of protesting, two people on both sides are going to have some very common interests. And it's that realization that sometimes can help us calm down a bit so that we can get back to the negotiating table and remain solution focused.
And even if you're just watching all this footage, the videos, the news of these raids and protests being everywhere on air and also on social media, where should people really just draw that line between trying to stay up to date and or putting the phone down to get away from it?
It's critical that we control what it is that we can, that we are constantly asking ourselves, what is the best and most effective use of my time and my resources? But it's critical that we control what we can. The end of the month is coming. I still got bills to pay. I got pressures. I have issues. And so it's important to not necessarily just neglect those things, but also make a positive impact. So it's critical to maintain the mindset that I want to control what I absolutely can.
It's a fine balance, it sure is. What are some mental health resources that people can seek out at a time like this?
Well, of course, for emergency situations where a person might be in crisis and they're having thoughts of death and dying, of course, you want to think about 911. But if you are wanting, for example, a suicide crisis lifeline, you can think about 988, where they have 24/7 resources. Of course, you want to think about county resources like LA County. And of course, for those of you in the San Bernardino or LA County, Dignity Health is here for you.
Dr. White, we appreciate your insight this morning, and hopefully it helps a lot of families out there who might be feeling some of that stress and anxiety. We appreciate it.
Can I leave you with a quote?
Absolutely.
The great John F. Kennedy, we all cherish our children's futures. We all breathe the same air, and we are all mortal.
I think that is a beautiful quote indeed. Dr. Whyte, thank you.
All the best.